Good morning, Saunders County. It's Dr. Akers, just coming to you from Saunders Medical Center with some updates with regards to coronavirus. And today I would like to talk to you about the multisystem inflammatory syndrome in children. The abbreviation that you may have seen in the news is called MISC. The other term that this condition goes by or has been used for it is called the pediatric multisystem inflammatory syndrome, or PMIS. So what this is an inflammatory response syndrome that we are seeing in children related to coronavirus. So I think Omaha does have their first suspected case. I'm not sure if they've confirmed it or not at this point, but I wanted to talk with you about what to look out for in your children and when to seek medical care. So the condition called MISC is related to the SARS-CoV-2 virus or coronavirus that most people are referring to it by. And it's a Kawasaki-like syndrome. What Kawasaki's is it's an inflammatory syndrome that with inflammation of the blood vessels caused by some trigger. And we don't always know the trigger. It could be a virus or a bacterial infection, but we do know that there's common presentations that a child will present with that has a Kawasaki syndrome. So this syndrome, MISC, presents similarly to Kawasaki's. The most common things that you would see in a child is a prolonged fever of greater than 3 days is per the WHO criteria. And the CDC says for 30 degrees Celsius or higher, which would be 100.4. But I know children's is using a cutoff of 101 for 3 days. So that's something you'd want to talk with your pediatrician about, what temperature and for how long to be concerned. Other symptoms of the condition would be swollen hands, feet, rash. You may see some involvement of the mucosal surfaces, so the lips or the mouth may be red or swollen, may have a strawberry tongue type appearance. Your child may present with abdominal pain, we commonly see diarrhea, but could present in other ways. As far as vomiting, we'll see redness of the eyes, irritability, and just in general can have some not feeling the best. So those are the most common symptoms that you'll see with this condition. But I will caution you, most children that do contract coronavirus tend to have mild or no symptoms at all. So we are talking about a rare condition, but it is serious. So if you ever have concerns about that your child may be suffering from this, especially if they were recently diagnosed with coronavirus or were around a close contact with coronavirus, don't hesitate to call us. You can always call us. We can evaluate your child in a safe situation, especially even if they have coronavirus, we can take care of them in a confined area or space where we can keep not only them safe and taken care of, but also protect our staff. We just ask that you always call us. If you have questions, give us a call and we can try and direct you in the right manner. Make sure that all of your questions are answered, but also that your child is taken care of. And it can be hard because we do have common cold viruses that we see, this time of year that aren't coronavirus. So usually we say cold and flu season is more in the winter, but things can happen at this time of year. Also, allergies are really bad right now. So just don't hesitate to call if you have any concerns. We're happy to answer whatever questions we can have, but we just wanted to touch base with you with the county to let you know about this condition, that it is on our radar, that we are, learning more about it as we go. Just like everything with coronavirus, we don't have all the answers. We are continuing to learn as much as we can so that we can better serve you. Hope you have a great day and take care. Bye.